I'm Dr. Abbasi. So tell me about what's bothering you. What's the problem?
My back sucks. Pretty much my lower back. I had emergency back surgery in 2017.
Tell me about it.
I had 4 herniated discs that they repaired. They did a discectomy and laminectomy. Everything was going good, and then about a year and 4 months later, I was hit by a drunk driver. And it's just been progressively getting bad ever since.
I see. I'm looking at your pictures. I see that they removed the back of the bone and they did a laminectomy and decompression. Is that about right?
Yeah, they told me laminectomy and discectomy. I'm not too sure what all those entail.
You know what levels? Did they tell you what levels?
They did not.
It seems to me that they did L3, 4, 5, and S1, mostly L3 to 5.
Oh, I guess that terminology does sound familiar. So,
okay. No, your pain. My assistant is telling me your pain is up to 10 of 10. Is that about right?
Yeah, when I'm active, so like standing, doing anything like physical, like I've been off since February 19th. I'm in my bed and I'm on my couch. That's all I can do.
And the pain is going down the left leg only or both legs?
Just the left leg currently.
The pain that's going down the leg, that's very important information. Is it in the front of the thigh, side of the thigh, back of the thigh, or all three of it?
All of it. Yeah, it's my entire.
All of it.
Yeah.
Okay, makes sense. Now, this has been going on since when again? This pain?
Well, I fell twice in February. Mm-hmm. It's been getting progressively worse, but like the leg pain is new as of February. I fell twice. We had a really bad snowstorm.
Do you notice any weakness in your legs?
Yes, extreme weakness in my legs. Like.
Okay. So let me show you what's going on. Okay, and unfortunately, lots of people have this kind of problem, and I explain to you what I see and what you should be doing for it. So let's start with this. Are you able to see what this your pictures?
Yeah. Yeah.
So this is the side view of your spine. This is up, this is down, this is front, this is back. The date of this surgery, let's see what it says. It's just recently, just about a month ago, so it's good enough.
Yeah.
This is bone disc, bone disc. Dark is the spinal cord, white is fluid, and the bottom 4 discs, the content of the disc is coming out, the disc is collapsing, and the material of the disc, look at that, they come and actually squeeze themselves out and push on the nerve in a significant way. And obviously that push on the nerve, that can literally, a disc is like a tire of a car that cushions the car against the road. It cushions 2 bones against each other. You have 4 flat tires in your back. And obviously, the bone, grinding the bone, that can give you back pain. Then it push on the nerve that passing through, that can give you leg pain. So you're not a medical mystery. I see what the problem is. And he said, now guess what? In the surgery that you got, we literally removed the back of the bone to open up the space for the nerve. Imagine your spine is already weak. By us removing the bone, we are making it even weaker. But that's sometimes what we do. Okay, so it's a very common thing that people who have what we call the herniated disc, we go there, remove the bone, and open up the space, and a few years later, symptoms get even worse. Unfortunately, this is a common problem. And the next time it happens, what we do is literally getting rid of the bad disc completely, and then stabilizing the spine by putting some metal in and making a brace inside, strengthening your spine inside so it doesn't fall apart. Okay?
Right.
So this surgery, open old-fashioned wear for 4 level, is a big surgery to start with. Now, if the patient gets bigger, and I apologize telling you, you're not a tiny person, that becomes exponentially dangerous because you have to go through more tissue. For that reason, most of my colleagues, if your BMI is above 40, they don't even recommend the surgery. Have you talked to any other surgeon locally?
Yeah, nobody will touch it. Nobody would do anything.
Yeah, I can imagine that. Nobody wants to touch it because you're big, and doing 4-level fusion is a big deal. For us, that's a routine things we do. Okay, because we don't cause all the damage on the way of going in. Now, having said that, we never jump to that. We do physical therapy and so on, but my assistant is telling me you did all of that. Is that about right?
Correct, yeah.
And practically, tell me exactly what other surgeon tell you about what the solution is. Did they tell you just have to live in pain, or what did they tell you?
They pretty much said you're too fat, go lose weight.
Yeah.
And I'm like, how? I can't lose weight walking to the toilet. I can barely walk to the bathroom. Like, how do you expect me to lose weight? And they're like, well, figure it out and come back and see us then. And I'm like, okay, so I mean, it feels like a death sentence. Like,
yeah, I'm totally with you on that, and that's almost unhuman. You know, how can you lose weight? Is a vicious circle. How can you lose weight if you cannot walk and do any activities? On the other side, the surgery is exponentially more dangerous if you have to go through more tissue, do that big surgery. Now, the only thing we are doing different that we do that surgery through a small tube that doesn't require us to open everything up. So we are
right,
able to do, and we did a study actually that doesn't add much more to our surgery than if you were thinner. Literally, you can do almost the same safe surgery at the BMI of 25 or 45 or 50. Now, what is your BMI? Do you know that?
it was, I think 56 was the
56?
last, I
Okay.
believe 56 or 58 sounds right.
So now, sometimes in the BMI of that range, I'm actually getting images is harder in the surgery, but I have enough experience. I feel comfortable doing that. Doesn't mean I can give you any guarantee or any kind of, that the surgery is risk-free. It is not. Every surgery has its own risk: bleeding, infection, coma, death, heart attack, and so on. Pulmonary embolism, and you have to push the nerve to the side. 50% of the time nerves are irritated. 85% people wake up and the leg pain is gone. That's the first thing people notice. And obviously, if you have a higher BMI, after the surgery activity, you're putting more stress on those hardware. That's always a risk factor. Do you smoke?
Former smoker, but I haven't smoked in 5 years.
So you quit 5 years ago, you're telling me?
Mm-hmm.
Good.
Yeah.
Okay. So your surgery is an option, definitely. And it seems you have maximized conservative therapy. And I have the feeling my colleagues never questioned that you need a surgery. They just couldn't offer it to you safely. Is that about right?
Right. Right. I just wish they would have been open and honest about that. Like that was, they were never, it was just like, at the last minute, like, oh, you're too fat, bye, as I'm being discharged. Like, sorry, we can't help you.
Yeah.
You're the fourth surgeon I've spoke to.
So what did the other three surgeons tell you?
Just those things. One said, I wish that you would have had me before you had your first surgery. He said I would have operated on you, but he said now with your weight, I wouldn't touch you with a 10-foot pole. And then the other two are just you're too overweight.
So let me tell you, I can help you. Okay.
Say the word, give me a date, and I will be in Minneapolis.
So, I have to put you through a process, though. I'm very proud of my results, but my result comes from a very conscious and deliberate kind of protocol. Okay. No, but you do need the surgery. I will. No, we talked about the surgery. We talked about the risk of the surgery. Do you have any question?
No. I've done a lot of research on you. I admire your work, and I mean, I trust you. So,
but I need you to understand that it's still a process. Okay, I'll get the medical clearance. If you have no other medical problem, you're a good candidate. We will talk more when you come to Minneapolis. And the surgery usually takes. Last time I did a surgery in your situation with your BMI, and I've done plenty of that. It took me about 2 hours, a little more than 2 hours. Even if your BMI was like 25 or 30, open old-fashioned way, that would have been 5, 6, 7 hour surgery. Okay, I will pass you to my office, to my staff. They will help you and they work around your schedule. Now, I know that my schedule is pretty full, but I'll try to do my best to work around it to make it happen for you. But just be patient. That's why they call me. Okay. Let me do my homework. Let me put all the right things together to make the surgery for you safer. Your situation is nothing out of ordinary. That people who are like unfortunate in a situation like you, that in this vicious circle, they cannot move and they gain weight. And they gain weight and that put more pressure on the spine. And literally, we doctors, we want to do the safe things and we condemn them to lifelong of misery.
right.
That's probably what you have been going through. You need to encourage those surgeons to just come and learn it the way that they don't have to massacre your back to get the job done. We can learn
Right.
it. That's surgeon, they can learn it. But we surgeons get so busy, we don't want to take time off to do that. And
Right.
your story that you said, how am I going to lose weight? I mean, that is a question for many people. And the fact that the two of them, they just look at you and just tell you go away, and the other one says, "Oh, I wish you would have come for the first surgery." That is more or less, is an empty excuse. Okay, so
Right.
the situation,
I agree.
and I think we need to get the awareness out there that there is an option.
My mom has a question. She's right here. I don't know if she's allowed to be on the screen or not. She's sitting like right beside.
Okay.
Hello, doctor. Nice
Hello
to
there.
meet you.
Nice to meet you.
My concern is getting him there. He is like, do we drive? Should he fly?
No, fly. Don't drive.
Fly.
Driving all that way, all those bumps on the road is going to make you miserable. You fly, but just make sure you don't carry luggage or somebody else is with you. Somebody else have to be with you. Somebody
Yes.
have to take care of those luggage, so you're not. I get patients from the entire United States all the time. Is the flying, obviously there's the takeoff and landing and so on, but driving is actually much worse. And we have what we call a concierge. We put you in our place. Every day you're here, my nurse will check on you. You're not the first person coming from a long way to get this care, because there are not many people who would offer you surgery in your situation. So I get lots of these people. We are prepared, and my office is there to help you with the details, okay?
Thank you.
Okay. Great.
Thank you very much.
Question?
No, that's all I got.
Okay, well, thank you so much, okay? You have a good